Okay, Protocol 7 is our pain control protocol, and within this protocol, the EMT will have the option of treating pain, mild pain, with ibuprofen, acetaminophen, or aspirin. For our INP level providers, you will have fentanyl, ketamine, and morphine at your disposal. Okay, let's take a look first at the first arm of pain management, pain treatment, and that is the PO medications. And you can use both arms of this protocol. You can use PO meds as well as IV, IO, IM, IN medications for pain management. So ibuprofen at 400 milligrams PO, or acetaminophen at 650 milligrams PO, or aspirin at 650 milligrams PO. Of course, we do not want to administer any PO medications for patients who may need surgical intervention for injuries, illness such as open fractures, fractured deformities, headaches, or abdominal pain. And again, the same contraindications apply to ibuprofen, acetaminophen, and aspirin as they do in other protocols. So ibuprofen should not be used in patients with known renal disease or renal transplant, in patients who have known drug allergies to NSAIDs, or patients with active bleeding, headaches, abdominal pain, stomach ulcers, or in patients who may need surgical intervention, as we've already discussed. Also, we don't want to administer acetaminophen to patients with a history of liver disease. So for our INP providers, for mild pain, the first arm of pain management treatment with our PO medications, pediatric patients greater than 6 months old, ibuprofen at 10 milligrams per kilogram PO, or acetaminophen at 15 milligrams per kilogram PO. Okay, so our moderate to severe pain, our INP level providers, you will have fentanyl at 1 to 1.5 micrograms per kilogram. The routes of administration are IV, IO, IM, or IN, and your max dose is 2 mics per kilogram, adults and peds. And you can add, if needed, ketamine, 0.1 to 0.5 milligrams per kilogram, adult. Paramedics can administer ketamine to pediatric patients, 0.1 to 0.2 milligrams per kilogram. I and P providers will continue to use morphine if indicated at 2 to 4 milligrams IV, IO, IM every 10 minutes to a max of 10 milligrams. And our paramedics can administer morphine to pediatric patients at 0.1 milligrams per kilogram, IV, IO, IM, max of 10 milligrams. And again, that is for our pediatric patients. Okay, so let's talk about the first of these two new medications in pain management. The first is fentanyl. It is a potent narcotic analgesic and a sedative, and the dose of about 100 micrograms is equal to 10 milligrams of morphine. However, there are some differences from morphine. Fentanyl has a short duration of analgesic activity. It lacks emetic activity and minimal hypotensive activity. So that makes fentanyl kind of the perfect drug for pre-hospital pain management. There are some contraindications: known hypersensitivity, bronchial asthma, a comatose patient with a possible head injury, brain tumors, concurrent patient use of a monoamino oxidizer inhibitor, and these are those first-generation antidepressant medications, and a systolic blood pressure less than 110 millimeters of mercury. All right, some precautions with fentanyl. Pregnant patients. Alcohol ingestion of your patient. This may increase the depressant effects. Side effects are analgesia, euphoria, constricted pupils or miosis, bradycardia, respiratory depression, apnea, muscle rigidity, suppression of the cough reflex, anaphylaxis, bronchospasms, pruritus, urticaria, and asystole. Okay, so now we're going to focus on ketamine or Ketalar. Ketamine is used as a general anesthetic, and it has been for many years. However, we're going to be giving it at the sub-dissociative dose for use as an analgesic. Ketamine is a N-methyl D-aspartate receptor antagonist, commonly referred to as an NMDA receptor antagonist. What this will do is it'll block the NMDA receptor to produce a dissociative anesthesia. Of course, we're giving this at the sub-dissociative dose. The purpose of ketamine within the protocol is to relieve pain, not to induce a catatonic state. So our dose for adults of 0.1 to 0.5 milligrams per kilogram, and for our paramedics, 0.1 to 0.2 milligrams per kilogram for the pediatric patient. Contraindications are hypertension and hypersensitivity to the drug. The precautions we need to be on the lookout for is this may have additive or synergistic effects when other sedatives are present. And side effects are hypertension, flushing, palpitations, dry mouth, nausea, and vomiting. Now, how we're going to be carrying ketamine is in a mixture of 500 milligrams in 10 mLs, which is 50 milligrams per 1 ml. Okay, so here's a note on the hypertension caused by ketamine. You can have an elevation in blood pressure, and it begins shortly after injection, and usually returns to pre-anesthetic values within 15 minutes after the injection. In the majority of cases, the systolic and diastolic blood pressure peaks from 10% to 50% above pre-anesthetic levels shortly after induction of anesthesia, but the elevation can be higher or longer in individual cases. Okay, protocol 8 is our pepper spray taser removal protocol, and we're really going to be focusing on the taser removal aspect of this in the skills portion of this protocol rollout. However, for the pepper spray, it is a basic irrigation of the face and eyes, removing any contaminated clothing. If they do have difficulty breathing, you're asked to exit to the appropriate protocol, which would be the respiratory distress protocol 46 or 47. And if they have asthma, COPD history, we want to observe them for 20 minutes, follow appropriate protocol if indicated. Protocol 9 is a rehabilitation for responders protocol, and this is for our firefighters who are engaged in active firefighting operations. There are certain parameters within this protocol for fluid resuscitation, predicting a max heart rate, and what to do if we have signs of orthostatic hypotension. Also, it will refer you to the carbon monoxide smoke inhalation protocol, protocol 23, if indicated. Okay, so let's look at orthostatic vital changes. For our advanced through paramedic providers, if we have a pulse increase of 20 beats per minute or a systolic drop of 20 millimeters of mercury in the blood pressure, we want to immediately infuse up to 2 liters normal saline until the heart rate returns to less than or equal to 100 beats a minute, and the systolic blood pressure is greater than or equal to 110 millimeters of mercury. Now, within this protocol, at the top right-hand corner, you do have the age-predicted 85% max heart rate chart. So, for example, a 20 to 25-year-old, 85% max heart rate is 170 beats a minute. The automatic transport criteria for our firefighters is chest pain complaints, cardiac arrhythmias, syncope, altered mental status, confusion, disorientation, shortness of breath unresolved by 10 minutes of high-flow oxygen, vital signs that have not returned to normal after 30 minutes of rest, any episode of vomiting or inability to hold fluids down, and obviously any request for transport. Now, some of our cooling techniques: removing the gear, cooling fans, ambient evaporative cooling, cold wet towels to the head and neck, and oral rehydration with water or balanced electrolytes and sugar sports drinks.